All right, so check this out. Hospitals and insurers are getting rich off your medical fraud. Just posted Wednesday the 29th, right? Crazy stuff. I think most people out there are aware that the medical industry has got a lot of problems. The insurance industry's got a lot of problems. But I don't think to what extent is the fraud that's going on, right? So this isn't just a story about our government. This is about your hospital bill, your Medicare dollars, and why the system feels like it's working against you. So, number one, let's talk about it. Hospitals, uh, they're hiding their prices from you, right? If you go through this article, it will go in depth, and I'll leave the link to this article for anyone that wants to read it. But it explains that a new study from Patient Advocate Partners in George Washington University and Stanford Medical School have shown that only about 36% of the US hospitals fully comply with federal price transparency rules. So, what does that mean? That means over two-thirds of the other hospitals aren't, right? So, and that's the law. They're supposed to be letting you know exactly what you're being charged and why you're being charged. All right. Now, the next thing you got to worry about is uh, hospitals and medical providers, they're suing patients through middlemen, right? We have one hospital system that they're referring to in the article that's literally filed over 15,700 medical debt lawsuits, but used a third party collection company. So companies don't even realize that they're being, I shouldn't say companies, but patients don't even realize that they're being sued by the actual hospital, right? Wages are getting garnished, banks are seizing your assets, and patients had no idea who was coming after them or why. It's pretty crazy. Medicare dollars are funding the insurers' profits. Well, obviously, we know that insurance companies are in business to make money, and they're no different than anybody else, right? The big insurance companies like United Healthcare, Humana, Blue Cross have seen their stocks rise roughly, four times faster than the rest of the market since 2010. That's pretty crazy. Much of that growth is fueled by Medicare Advantage and their subsidies. The money flows to the shareholders and not back to you, right? Benefits aren't getting better. So that's crazy. What else? The article's covering 100 million Americans currently are in medical debt. Medical costs are the number one cause of personal bankruptcy right now in the country. Not job loss, not bad investments, medical bills. That number should stop everyone in their tracks. That's mind boggling to me. That's a big, big problem, right? And also, what this means specifically for Medicare consumers, you need to really, and I always try and advocate this to my customers, you need to look at those things that come in the mail. Those things that say this is not a bill. It's called an explanation of benefits, an EOB. Okay, explanation of benefits is one of your most powerful tools. You review them. If something looks wrong, then you shouldn't pay it. If a service you didn't receive is a duplicate charge, you shouldn't pay it. You need to question everything. And CMS has a fraud hotline. So you could be part of the solution by letting CMS know, the Center of Medicare and Medicaid Services, in case you didn't know, that's what CMS is. Let them know, guys. See something, say something. This kind of stuff's got to stop, right? And listen, as a broker, my job is to make sure not only that you understand the plan you're on, but how the system works. That's how a good broker works, right? Anyone can enroll you in a plan and take your name and address and whatever, put it on an application. But it's important to navigate the system. The system is like a game and it has rules. And if you play by the rules, you tend to get better results and you tend to be more of a winner than a loser. When you don't understand how everything's worked and you're not an informed consumer, an informed consumer is the hardest one to take advantage of. That's exactly why I do what I do. That's why I do webinars. That's why I do seminars. That's why I make these videos. Guys, just pay attention out there, right? We're seeing rates for insurance skyrocketing. We're seeing costs for doctor visits, for hospital stays, surgeries. Everything is going up, 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 up. Just make sure you're looking at your evidence. I shouldn't say evidence of coverage, your explanation of benefits. Make sure you're not getting overbilled. And if you have questions, need any help with this type of stuff, always feel free to reach out to our office. We are the Modern Medicare Agency. My name is Paul Barrett, and you can reach me directly at 631-358-5793. I've been doing this since 2007, guys, and it's getting out of control. So if you have questions or concerns about your coverage or a bill or something silly, we're happy to answer your questions. Have a great day.